Aim of this experiment is to study the effect of adrenaline on frog's heart. Objectives of this experiment are to record and understand mechanical activity of heart, to understand chronotropic and inotropic effects, to understand mechanism of action of adrenaline on heart, to understand the terms tachycardia and bradycardia. Adrenaline and noradrenaline act as neurotransmitters at sympathetic sites and in some areas of brain. Adrenaline, like sympathomimetics, increase heart rate by activating SA node or pacemaker. SA node is pacemaker of human heart, which regulates heart rate. Adrenaline increases rate of depolarization of SA node and thereby increases heart rate. You can see the gap between two action potential peaks is less in presence of adrenaline. Both adrenaline and noradrenaline also activate latent pacemakers, that is AV node, Purkinje's fibers. Force of cardiac contraction is also increased due to adrenaline. Adrenaline acts on both alpha and beta adrenoreceptors. Heart is innervated by beta adrenoreceptor, to which adrenaline interacts and influences change in permeability for calcium ions and sodium ions. This change in permeability leads to excitatory effect on heart muscle and increase in rate and force of contraction of heart. Adrenaline increases force of contraction of cardiac muscle along with heart rate by increasing permeability to sodium ions and calcium ions. Adrenaline increases rate of depolarization in cardiac muscle, which leads to increase in contractility.
For studying the effect of adrenaline on frog's heart, perfuse isolated and mounted frog's heart with frog ringer solution. Now start the drum and record normal contractions of heart on smoked paper for 1 minute. In these tracings, the number of peaks per minute indicates rate of contraction of heart, whereas height of a single peak indicates force of contraction. You can see that all the peaks in the tracings are of same height and at same distance. This means contractions are rhythmic and with normal tone. Stop the drum, inject 0.1 ml of adrenaline solution in the cannula, start the drum immediately and record the response of heart on the smoked paper for 1 minute. you can see that the rate of contraction and force of contraction of heart increases due to adrenaline. Also observe rhythmicity and tone of contraction. Repeat the same procedure by injecting 0.2, 0.3 and 0.4 ml of adrenaline. Allow a time gap of 5 minutes between two successive doses to wear off the effect of earlier dose. From these observations, we can say that adrenaline has positive chronotropic and positive inotropic effect on heart. Thus, adrenergic drugs find application in bradycardia and as cardiac stimulants.
You have learnt that adrenaline stimulates heart functioning by increasing its rate and force of contraction. Adrenaline acts as cardiac stimulant.